Hi again, it's Matt from Glaucoma Pirates, back again for video number 9. Today's video I'm going to be sharing my personal experience with Trab. Pronunciation's not very good. I'll call it a Trab, but I believe it's something like Trabeculectomy or Trabeculectomy or something like that. Anyway, it's a Trab, which some of you may be having to have done in the future, or some of you have already had done, or some of you just about to have done, and maybe that's why you're watching the video. So hopefully my experience of it will give you some insight of what to expect. So obviously after the cyclodiode that I had done, which was to buy a little bit of time, it brought my pressures down again to the sort of mid-20s, and it was about 5 weeks after the cyclodiode in August, so it was in September that I was scheduled and booked in to have the Trab. This again was still done, I was still under private care at the moment because I could still afford my private insurance at this stage, so I had the Trab done privately, so it was a nice experience as far as the hospital was concerned. You treat it more like you're on holiday than you are going to hospital, so that's nice. Went in about 7 o'clock in the morning. The greatest thing about my Trab is that it was done under a general anaesthetic, which is the best thing ever when you've had eye surgeries under local anaesthetic. Yeah, I'd rather be out. I know it's not for everybody, and I know it makes a lot of people ill, but general anaesthetics, I've had quite a few over the years with problems with my knees and stomach and things, so I'm quite familiar with general anaesthetics. I've never had any problems with them. I've never had any bad reactions to them. In fact, I always find waking up with a general anaesthetic, you're always quite euphoric, so it was all good, and I was looking forward to the fact that I had a general anaesthetic for this surgery. So my experience of the day, you roll up at the hotel, you're shown to your room straight away, you're given a bed straight away, then you'll just then have a barrage of activity for an hour or two before surgery, where the nurse comes and checks all your blood pressure and vitals and everything. Then you have the anaesthetist come in and see you and talk you through what he's going to do. Then you have the chef comes in and asks you what you want for dinner when you wake up, what sort of sandwich you want or whatever. I know, it's great. And then the surgeon comes in with his junior doctor, and they mark up your eye with a big arrow to make sure they get the right eye, and again just explain what they're going to be doing, and then before you know it, you're asked to walk. You're not wheeled. You walk up to surgery, quite relaxed. You lie on the anaesthetist's bed, and they give you the gas, and then they put the cannula in your arm, and before you know it, you're fast asleep in happy land. So yeah, that's all good. Then I think the Trab surgery actually lasts about 45 minutes. It's not a massively long operation. And then you wake up in recovery, feel a bit groggy. At first your eyes are closed, and then eventually you come round, obviously with just one eye open because your other eye is dressed, and I'll put some pictures up of what I look like at that stage. So you've got your eye patch on. You can't see, but only because of the eye patch. Yeah, recovery after that is pretty good. Within a couple of hours, you sort of, they're bringing you your food, and you're getting up and going to the toilet, and an hour or so after you've got up and stuff, they're letting you go with a bag full of eye drops, because all your eye drops are different post surgery. So you come off all the pressure lowering drops and go on to all the steroids and drops that are supposed to prevent you scarring and that sort of thing, and also to moisturise your eye. So you get your bag, and then you're allowed home. With the eye patch and everything, you're told to keep that on till the next day, which is always the norm from all the surgeries I've had, I think. And then you're also given a protective shield, which you're supposed to wear at night when you go to bed. I think that's just to prevent you from rubbing your eye in the night and knocking your eye and things like that. So yeah, that's the day of surgery. Then you wake up the next day, you take the eye patch off, and then you look in the mirror and you think, oh my God, what have I done? I'll put some pictures up so you can see, but your eye is very red, very weepy, quite sore by now because the local anaesthetic that they put in has started wearing off. But I wouldn't say it's unbearable. It's not the worst. Pain-wise, it's noticeable, and you may need to take paracetamol for the first couple of days, but it's nothing that you can't cope with. The hardest thing for me is always after surgery, getting used to the vision again, because my vision is always 10 times worse after surgeries, and then it slowly, gradually gets better as you recover from the surgery. But mainly it's just very, very blurry, to the point where you have double vision a little bit. I find it really hard to watch TV and stuff. Although you can watch TV and it's not a problem, but it's just getting used to watching TV with a really blurred. I actually got a patch, and I was wearing a patch to watch TV because I found it easier to see when it's just black on that eye than it was when it was really blurred. So there's a tip for you if you are struggling with the vision because of all the changes and everything. Just stick a patch when you want to do something where your vision is really important. Obviously, banned from driving. Well, not banned from driving, but you're told not to drive for at least a couple of weeks after surgery until the surgeon has said, yeah, your eyesight's good enough now to drive. You can't lift heavy things. So shopping was out for a couple of weeks, which wasn't necessarily a bad thing. It's like after any surgery, I think your life just goes on hold for a couple of weeks, and you just rest and recuperation is the best thing for you. And generally speaking, it wasn't, it was okay. But just as anybody after an operation, you get bored and you're fed up of not being able to see properly and being in pain, but it's not the end of the world, and you know that the target is to lower your pressure. My pressure, after surgery, you have to go back the next day to a first checkup, and then you have to go back after like 4 days, and then you have to go back every week for a couple of weeks. And my pressure did drop. In fact, initially it dropped too low. It went down to sort of 3 or 4 in my left eye straight after the trab, which can happen sometimes. Again, that made my vision probably worse than it would have been if it hadn't have dropped. And your vision gets a little bit better once the pressure comes back up again, which it did in my instance. And then it tended to settle around the sort of 12 or 13 mark for a few weeks. And then once all the the blurriness has settled down a bit and it gets a bit more normal, it's a lot more manageable, and you feel happy that it's worked. It's kept the pressure down for now. However, at the end of that process, probably 4 or 5 weeks in after the trab, it was noticed that I was excessively scarring on the eye, which was causing a little bit of problem with vision, but more problem for the trab to be effective. So the pressure was creeping up again going into the mid-20s. So at that point, it leads on to my next video, which was my first what they call a needling procedure, which is to aid the scarring. But we'll talk about that in the next video, because I think this video is just about done. So thank you for listening to Trab. Hopefully that information is useful to somebody. If not, carry on watching the other videos. Something else might be useful for you. Thanks for watching, and don't forget to subscribe, and I'll see you next time. Thank you very much. Cheers.